Waikato will see an easing of COVID-19 restrictions this week after Cabinet agreed to move the region to Alert Level 2 from midnight tomorrow. The move was described as a temporary one by Prime Minister Jacinda Ardern as she revealed the government's eagerness to move to the new COVID framework earlier than previously outlined.
In some ways, the COVID-19 protection framework provides more safety than even Level 2 of the Alert Level system. For example, currently in a region at Level 2, everyone can go to a hospitality setting, vaccinated or not, with the Level 2 key restrictions of a maximum of 100 people seated and separated. However, at Red and Orange in the new framework, you'll also need to be vaccinated, which adds an extra layer of protection.
The new framework would require vaccination certificates to work, and opportunities to download them are said to be imminent. Ardern said a decision will still be made on November 29, while an announcement on Auckland's border will be made this Wednesday. The announcement will reveal when and how the boundary will change and provide more detail about expectations for the rest of the country. It comes as 173 new cases of COVID-19 were reported in the community today, 163 in Auckland, 7 in Waikato, 2 in Northland, 1 in Lakes District, and a new case in Wairarapa. 63 of those cases have been linked to the outbreak, while 110 are yet to be linked. One further resident at the Rosaria Rest Home in Avondale has tested positive for the virus, bringing the total number of residents at the facility with COVID to 4. There are 90 cases in hospital and 7 in ICU. To date, 66% of those who have been hospitalised with Delta are unvaccinated or not eligible, while 90% of the eligible population have now received at least one dose of the COVID vaccine. 81% are now fully vaccinated. Ardern added that from November 29, anyone aged 18 and over who got vaccinated more than 6 months ago will be eligible for a booster shot. The booster shots available at pharmacies, vaccination clinics or GPs would be free for anybody in New Zealand, whether or not they were first vaccinated here or overseas.
Boosters are a belt and braces approach. Lifelong protection from vaccines is not always possible, and we see that in the likes of tetanus boosters. The science has shown us that providing a booster 6 months after the primary course essentially tops up immunity levels back up to the mid-90% mark, reducing the risk of severe disease and therefore the burden on our hospitals. They also help to protect against any future variants by boosting an individual's overall immune response.
Today also marked the deadline by which workers in the education, health and disability sectors had to have their first dose of the vaccine under the vaccine mandates. No schools have been unable to open for learning today as a result of the mandates, although 11 schools are indicating they have a high risk of losing staff. Overall, there have been 4 exemption applications which are being assessed by the Minister. Meanwhile, a major change in MIQ has taken place, with the length of time international arrivals to New Zealand must spend in managed isolation now halved from 14 days to 7, followed by self-isolation until a negative day 9 test is received. Joint head of MIQ, Brigadier Rose King, called the shortened stay a significant milestone in reconnecting the country with the world, while Director of Public Health, Dr. Caroline Michelnay, said the public health risk was low.